Welcome back to the Morning Blend. Well, the CPAP mask is the most common way to treat sleep apnea, which is a dangerous sleeping disorder. But many people will say the mask is uncomfortable and awkward.
So today, alternatives to the CPAP. Dr. Madan Kandula is from the Advent Snoring Center. Thanks for being here, Doctor.
Thanks for having me.
Nice to have you.
I think it's good that a lot of the word has gotten out about what sleep apnea is. A lot of people are familiar, but for those who aren't, how would you describe sleep apnea to someone?
It's pretty simple. It's basically stopping breathing when you're sleeping at night. And stopping breathing is not good anytime, but when you're sleeping at night, you don't have sort of the protective mechanisms to understand what's going on. So what really happens is the back of somebody's throat collapses down, shuts down. They're trying to breathe, and it's like you're getting strangled from the inside.
So this is normal.
This is normal. So this shows, those arrows show where the air is going through. It can go through your mouth, can go through your nose. And if things are working, things are open, everybody's happy, you're not snoring, you're sleeping peacefully. However, if things shut down, that's bad news. So all of a sudden you go from open to close, snoring starts in, snoring can lead to pauses. A lot of times, most people who have sleep apnea have no idea that it's going on. Their bed partners and those folks in the house can say, hey, you're snoring, there's something going on. But for somebody that it's happening to, they don't really know. And a lot of folks come in and say, well, yeah, I just snore, I don't have sleep apnea, I know, I don't have any, I don't pause. But it's really impossible to know whether you do have those pauses and without a sleep study. There's really no way to know that. And lots of folks have episodes, hundreds of times an hour and have no concept that it's going on.
Except that they're exhausted during the day and they can't function. Right. I know sometimes is the case. The CPAP mask is kind of the gold standard as it relates to treating sleep apnea. What is the CPAP? Why does this work, or why is this effective for some people?
So what this is, it's basically a mask that sits either on your nose and your mouth. And what that's doing, it's pushing air through. This is one device that we're showing here. It's pushing air either through your nose or your mouth into the back of the throat, and it just tends those areas open. So the areas that we just showed collapsing down, the CPAP machine pushes air out. It's like a vacuum cleaner in reverse, and so all of a sudden those areas are staying open. If it works and it's working well for you, it's great. And so lots of folks, it's the right fit and it's great, but unfortunately it's not natural. I mean, it's just, you're not sort of born to have a machine on when you're sleeping at night, and lots of folks don't like the concept or they don't like the reality. So they've got sleep apnea, they've taken the right steps, they know they've got an issue, they know that, or they think they know what their option is, and it's just the singular option, and a lot of folks say, that's not for me, or I've tried it and it's just not working for me, and I'm just going to stick my head in the sand and kind of forget about this.
Yeah, and pretend that it doesn't exist anymore, but doing that can be more detrimental because, as we were talking about during the break, it's not only that it wakes you up and you can be exhausted, but it's hard on your heart, so it can lead to a lot of problems there. So what other options are there? Somebody doesn't like wearing the CPAP mask, or they're just not going to use it. Unfortunately, there's other things that they can do?
Sure, there's sort of three categories. The CPAP is one category. There's something called an oral appliance or a dental appliance, which is another category, which is basically like a retainer that you wear when you're sleeping at night, and it basically just pushes your lower jaw forward and helps to open your airway up that way. And then the third option is sort of a whole group of options, surgeries and procedures that we can do in the back of the throat to really open up the airway. So the folks that are ideal for that category are folks who have anatomic issues in the back of the throat, where they've got big tonsils or they've got just redundant tissue back there that's really blocking them up. And so for those folks, we can, sort of get rid of the machine, open up their airway back there, and they're sleeping, like they're supposed to.
Well, and even if someone's willing to use the CPAP and they get past it being somewhat uncomfortable or awkward, if you have nasal blockage, for example, or some of the other problems you described, it can make it difficult for the CPAP to do what it's intended to do,
and that's sort of the, it's definitely underknown. Most people know they have an issue with the mask, but they don't know why they're having the issue. The most comfortable way for somebody to be sleeping is just breathing through their nose. If somebody has a blocked up nose, they're used to breathing through their mouth, which is fine, but then all of a sudden when you're trying to stick a mask on your nose and your one good airway, which is your mouth, they don't like it. They can panic, they get claustrophobic. It's just not good for them. They know that something's not right, but they don't know what's going on. And a lot of times it's as simple as their nose isn't working, and if we can get their nose working, then all of a sudden the machine can work and everything's fine.
Well, all those things are so interconnected, and you said earlier one of the only ways to diagnose it is with a sleep study, and most people think the traditional overnight study, you go in, you don't want to do that, but there's other options that you have at Advent Snoring Center too.
Yeah, I mean, there is certainly the option is there to do a traditional overnight sleep study in a sleep lab, but a lot of folks sort of see that as a barrier. They just don't want to take the time out of their life to do that, and so what we have is a home sleep study. It's basically a little sort of strap that sits on the forehead with another little this is it, and that's it. That's the entire device right there. So you go to sleep with it, and basically you go to sleep, bring it back the next day. We just plug it into the computer, download the information. It gives us the exact same information that the sleep study is giving us. So we know if there's trouble, we know how much somebody's snoring, if they're doing more than snoring as far as the sleep apnea goes, and it really lets us know, okay, this is the issue and this is the severity of it going into treatment.
So if somebody has sleep apnea, or they suspect that they do, but maybe the CPAP isn't working for them, and they know that's not an option for them, what's the first step?
Just getting checked out. I mean, I think a lot of folks just get frustrated that their algorithm, it just is a dead end, and I see lots of folks every day that say, I just don't know what else to do, and that's sort of the reason I'm here, is to let folks know there are other options. I mean, CPAP may be the very best fit for you, and that's great, but it may not. I mean, there may be other options that are going to be a better fit for you. If you're frustrated and it's not working, then it's really a matter of life and death as far as figuring out what's going to be the right fit for you.
Definitely, and I think it's amazing now that people can actually their sleep can be studied from home, the comfort of home. So here's how you can get in touch with the Snoring Center at Advent. Advanced ear, nose, and throat specialists are located at Highway 100 in Watertown Plank Road in Wauwatosa. You can call for that evaluation to make an appointment at 414-771-6780, or go to this website. It's advent.md. Always nice to see you.
Always good to be here.
Thank you
Thank you very much.
Still ahead on the show,